Hi, everyone. I am Dr. KatherineT.Kelly. I am a holistic health psychologist, author, speaker, and soul healing specialist. And as a soul healing specialist, I want to bring to you some information about why it is important for you to understand energy as part of understanding your experience of mental health concerns. So there is more research coming out there, and there are more practices coming out there, and psychology has come a long way in talking about energy. And now there are energy practitioners that do mental health work. There are things like tapping, there are things like energy healing, there's energy psychology, all these different fields that are starting to weave in the understanding that energy plays a part in our healing. And so years ago, probably 4 years ago, I actually went to a conference that was called Energy of the Mind. And it was a conglomeration of neuroscientists, neuropsychologists, neurobiologists that came together and talked about different things that happened energetically in the body, mostly in the brain, when we have trauma, when we use substances, when we have health problems, when we have different kinds of concerns that go on. Trauma, of course, is part of this. And so they were talking about how literally our brain changes as part of this. What they didn't talk about is how the soul changes as part of this. And that's always how I look at anything I read or watch, is I look at it through the lens of the soul, because the soul is energy, is the ultimate energetic force within us. And so, people have tried to, I should say, a person tried to measure the soul. About 100 years ago, there was a physician who tried to measure whether or not there was a weight to the soul. And it's an interesting concept. It's never been replicated. He tried to say that it was like 2.4 ounces, something like that. But the thing is, he tried to measure this, and I find that amusing. But really, energy is one of those things. Energy does have mass, it has energy, it has a weight to it. But the thing to think about is that the soul is the ultimate energy within you. It is that never-ending kind of entity that goes on, from situation to situation, from lifetime to lifetime. But we have to start understanding how we become wounded, how mental health concerns play a part as part of our soul healing, if we want to reach what I call sustainable whole person health. And that is, I think, one of our biggest challenges in the world is we don't look at health from a whole person perspective. We break it down into maybe the body and the mind. We don't really look at the soul aspects. So I want to help you understand how energy plays a part here. So I'm going to start with the soul itself. So if you can imagine your soul as this sort of energetic sphere of energy that travels with you, but it also plays a part in every cell, every muscle, every emotion, every aspect of your life. It's not something you can find in the body, but it is the energetic essence of who we are. And when you walk into a room and you have someone in there that's really upset and downtrodden, you can feel it. That is the energy of their soul that's kind of emanating that kind of aspect of who they are at that moment. On the other hand, when you go into a party or you go into some gathering that's uplifting, you can't help but find yourself feeling that energy, feeling that essence of all those souls coming together and celebrating in whatever way that they are. And so we can sense, and we do sense, the energy of other people's souls just by walking past them or just by being in the same room. But sometimes we don't pay attention to what it is doing to our own soul. And so this is an important part of us kind of doing that soul healing and that internal assessment of, gosh, when do I feel the best? When do I feel the worst? If you come away from a group or a particular person and you tend to feel worse than when you did when you got around that person or group, that's pretty good information for whether or not you're picking up on their energy. Now, I believe that there are more empaths in this world than actually know that they are empaths. And an empath is someone who automatically picks up on a person's energy. They feel what they feel. They take on what they feel. So it's almost like they become saturated with the experience of what that other soul is going through at the time. They don't have great boundaries. They don't know to have great boundaries. And so a lot of times it's like they become very permeable and very, like I said, saturated by the other person's experience of what they are going through at the time. But I think there are more of us that are intuitive and empaths than we realize, because look at the number of people that are having difficulty. Look at the number of people that feel drained when they are around people. This isn't just an introversion versus extroversion thing. This is about the energy we are picking up from others in the world. I mean, the world around us and the world at large. And I will say something about that. The world at large is so disrupted right now that more and more people are feeling anxious, more and more feeling people are feeling depressed, they're feeling more fearful, they're feeling more discontented, they're feeling like that fight or flight aspect is coming, that they just want to get the heck out. So energetically speaking, we are sponges right now. We are taking on the energies of those around us and the energies of the collective of 8.6 billion people on this planet. So we have to be super careful. When it comes to mental health, now I want to help you understand this. I'm teaching this course to practitioners and coaches about how to integrate soul health into their work. And one of the things that I'm teaching them is that everything is energy. And when it comes to mental health concerns, every single type of mental health concern has its own kind of energetic frequency or energetic kind of profile to take a look at. So for instance, and I've talked a little bit about this in videos before, is that from an anxiety perspective, which happens to be the number one mental health concern in the world, and it ramped up even more during COVID. It's ramping up even now because of all the state of the world issues that are going on. But anxiety is one of those things where, if you think about the essence of who you are, if you think about that soul part of you, if you are feeling the external energies, your own soul is going to feel discontented. It's going to feel uncomfortable. It's going to feel more anxiety. You may not attribute that to what's going on in the world outside of you. Some people do. But you have to think about, if we already have our own energetic wounds, if we have things that have happened in our lives that have stamped us energetically from a wound perspective. So in other words, we have difficult experiences in childhood. We have difficult experiences in teenage world. We have difficult experiences in relationships or at work, or maybe we had an accident. Maybe there are uh, most recently in our area, natural events. We've had hurricanes in our area. We've had other kinds of things happening. Whatever that is creating an energetic imprint on your soul and on your soul story. When I say soul story, your evolution, your path, your soul path that you've experienced. And if you don't know to dissolve and remove that energetic imprint, it's going to collect, and another one's going to collect, and another one's going to collect, and another one's going to collect, to the point where at some point you can't manage it well anymore on your own. But from a mental health perspective, I think this is where a lot of practitioners fall short. Now, I believe 100% in mental health. I've been a psychologist for many years. But I think we are missing part of the point. And this is why it is my mission and my passion to talk about the soul's aspects of healing. So if a practitioner doesn't know, or if you as a client don't know that these energetic imprints have stacked up over time, and yet you can look back and go, yeah, this is when this happened. This is when this happened. If you don't know how to dissolve and remove that, it's going to collect over time so that mental health concerns become worse in your life. And if you're not willing to look back and deal with those kinds of things, you can pretty much be assured that you'll have worse and worse mental health concerns moving forward. So, from an anxiety perspective, I usually try to explain that as an energetic misfiring due to that energetic imprint that was laid along your path that still needs some attention. So, from anxiety, it's an energetic imprint, it's a misfiring that is happening because of a fracture or a wound or a scarring or something along your lifetime that still needs attention. Now, we can work on all the thoughts about those situations, we can try to shove it down. But that anxiety piece of this will come up, will come up, will come up. And if we don't deal with it. Now, I have a couple clients now that are in their 70s, and they were high achievers, very healthy practitioners. One of them's when I say healthy, they had healthy lives, they very effective, very productive. But then when they got to their retirement years, hell broke loose. And it's because they couldn't keep a cap on their anxiety anymore because of their past trauma. And I have one particular person right now I'm working with that, and she's gotten to a much better place, but she was a physician, and she had a 46-year, I think it was 46, 47-year career. And yet at the time of her retirement, everything broke loose. Everything she'd ever experienced. She had some childhood trauma. She had some marriage trauma. She had other things that happened that seasoned her soul along the way, stacked up all of those energetic imprints to the point where now, the lid popped and it has all been coming out the last probably 4 years. So from an anxiety perspective, the energy of anxiety is a misfiring kind of energy. If I move on to depression, depression is a different ball of wax. It's still an energetic kind of thing. But the thing is, it's a suppression of the soul. The energy of the purity and the authenticity and the genuineness of that soul is somehow suppressed. It could have been because a tragic event happened. It could be because of extended grief. It could be there's a terrible situation in their marriage or a terrible health situation. But there's something that is suppressing the soul. So the energy of depression is that of suppression. When we talk about trauma, again, trauma is very related to anxiety, but it's a different kind of anxiety. And in fact, in the psychological and psychiatric world, trauma has been separated from general anxiety. Now, they're very related, but they usually come from different things. So, from a trauma perspective, it is another form of misfiring. It's another form of kind of a glitch that's in the system, a scratch on a record. For those of you who remember what vinyl records were, that there's a skipping, there's something that happens, but it throws people into the re-experiencing of that old trauma, whatever it was, at any given time. So it's almost like, again, the soul is trying to beg to take care of trauma whenever you have a panic reaction or you have a flashback or you have some sort of reaction. It's your soul's way of trying to get you to do the healing work. But the problem is sometimes and oftentimes the healing work is not getting down to the energetic level. It's only going to the mind level, maybe the emotional reaction level. And it's beautiful work that's being done, but if it persists, it usually means that you still have that energetic kind of glitch that's in the system that's getting triggered. Now, I will say this before I move on. I attended a conference recently, and one of the talks that I went to was one about uh, psychotherapy assisted ketamine treatment. Now, I have to say, think about that slowly because there's ketamine treatment that doesn't have psychotherapists present. The most effective way of doing ketamine treatment for trauma is basically to do it with a basically assisted by a psychotherapist that is there at the time that can guide you through. And it was really interesting because I was listening to this talk. There's really beautiful research that's coming out. There's wonderful, from a medical perspective, there's wonderful progress. But I'm watching all of this and thinking, okay, so they're saying that, most people have to continue going back to that ketamine treatment, every 4 to 6 weeks, sometimes every couple months. And I'm thinking again, once again, the energetic imprint that is there is not being taken care of. It is basically just the temporary band-aid effect. I don't like to use that because, again, this is helping people greatly function in life, but we've got to get down to the energetic glitch to begin with and kind of shave that off, meaning doing the soul work to release that. Otherwise, the traumatic responses will persist. Grief is another one of those things. We have an energetic impact when we lose someone or something. And so again, it's a mixture of things. Sometimes it's anxiety mixed with depression. Sometimes it's a traumatic response. So grief is a different ball of wax because it's sort of a mishmash of different reactions, as well as what I would call karmic grief, which is, again, this is a whole different topic, but it's the energetic removal of the karmic strands, another word that I use, karmic strands that are connected to that person if you've done the work. And so the thing, when I say is done the work of whatever that soul was there for you to help season your life in the first place. Grief is a complicated kind of thing because it's a different kind of reaction, and there's lots of soul-based work that needs to be done when it comes to grief. But what I'm trying to emphasize here is that whatever the mental health concern, there's a different kind of flavor or energy around the energetic impact that stays with that person depending on what it is they're feeling. I am not at all saying that there's not some biological perspective. So there are biochemical deficiencies or imbalances that cause some of these things as well. But there's usually some sort of energetic imprint, some sort of energetic place that even the patient sometimes knows, okay, we're not getting to the bottom of this, but at least we're managing this. So there's a core piece of this that needs to be looked at and worked on. I have many clients who came to me in extreme turmoil, extreme traumatic responses. And yet, when we've done the work, both the psychotherapy work and some of the soul healing work and some of the energetic removal, they are able to go on with life with no longer having any of those energetic responses. But it's about learning to weave in the soul healing and understanding which soul healing practices actually need to take place in order for that particular person to experience what I call, again, whole person health. So this is why I'm teaching other practitioners. This is why I'm doing these videos, is that if you're not finding full relief, you might not be getting everything you need in order to completely, clean the slate of what it has, what those energetic imprints have caused for you. I talk about the soul story, and the soul story is basically your timeline in this lifetime and previous lifetimes that helps you realize how you got programmed with these energetic impressions. And and that is one of the ways that I can help people understand what kind of healing they need, is for them to understand how, again, they evolved. They probably feel like it was devolved in some cases, but how it is that those energetic imprints or impressions have stuck with them. And so this is all about the body, mind, and soul healing aspects of mental health. Is how the heck do we get to those core levels? It's really only going to happen through the soul level. So just more information. I know that there are not very many soul healing practitioners out there. I'm trying to change that and doing certifications for practitioners and helping them understand all of this. And if they don't know how to do some of the soul healing experiences themselves, teaching them who to go to and how to work with other practitioners to do that whole person health approach, because not everybody can do everything to help this help a particular person. But I want to, with the Soul of Psychology series, just help you understand how the soul is so integrated and interwoven into mental health, and how we can go further and deeper in order to heal. So, hope this information was helpful. If you have suggestions for other videos, I'm happy to hear what those are, because I want to know what you need, and I want to be able to present to you information that will be helpful for you. So, have a wonderful day. Tune back in, send me comments, and I will continue on this journey. This is my absolute passion, to bring this ancient wisdom to the modern soul to help people heal, because right now we need the soul in order to evolve, and we need the soul in order to feel healthy and to move forward. Have a great day.